Dr. Mansoor Khan. I'm one of the founders and CEO of Persivia. It's a great honor to be speaking to all of you today about what we expect to see in healthcare as we move forward. I want to start off a little bit by looking at the big arc of what's happening in our country and what's happening in healthcare over the next decade or so. So as we enter 2025, I want to talk a little bit about what we expect to happen and to see through 2035, and then what impact might have on things that are happening today and how things that are happening today might impact what happens over the next decade. So the big story, as is the case for most of the world, is demographics. Today, we have approximately, or in 2015, we had approximately 4 workers for every retired person in the US. By 2035, we expect to have only 2 workers for every retired person. And so you begin to see the problem that we're facing. The problem is multifold, and it's going to require a lot of innovation both in terms of processes, in terms of healthcare, in terms of technology, and in terms of government policy and spending to address. The first thing that it impacts, obviously, is our ability to staff appropriately to support this ratio of elderly folks to working age folks. And there's already, as of 2025, there's about a 5% shortage of physicians, and by 2035, that's expected to grow to 10%. So we will only have about 90% of the physicians that we need to support the population in 2035. And as most of you know, getting an appointment with your physician is a multi-week, if not a multi-month process. So you take that forward, you double the population that is requiring care, and you can start to see what the problem is going to be. Combined with that and resulting from that is the government funding situation. The federal government is already spending trillions of dollars on healthcare, and that's expected to keep growing. So there's going to be significant pressure on the federal government, specifically as it cares for Medicare and Medicaid, as to how to finance and fund those activities and where to get the money from for the care and the quality of care that we're all used to getting. The other side of it is that consumers are becoming much more savvy, and consumer experience is becoming a really big part of the healthcare delivery process. All consumers now search online and expect to find good information online. And when they show up to meet their care provider or when they interact with the healthcare system, they come with a lot of information and ammunition about what they need and what they might need and what they expect in terms of care. So that creates a whole new set of stresses that didn't exist before on the healthcare organization in terms of being able to attract and satisfy the kinds of consumers and patients that they want to. So this trend of consumerism in healthcare is going to be a significant story over the next decade. To address this, we have to think about 2 things, and there are 2 sorts of key initiatives that are happening to try to address this. One, and the foremost one, is value-based care. We expect value-based care to keep growing, sort of irrespective of what administration comes in, whether Democrat or Republican. These pressures are not going to abate, and value-based care is going to become a bigger and bigger piece. What does that mean? That means more and more capitation. That means more healthcare, more home care. It means more primary care. And it means, very significantly for healthcare providers, more control by the payers. Payers are buying up providers, they're buying practices, they're buying healthcare delivery organizations, so they want to inject themselves into the care delivery process and try to control costs and quality by being part of the process rather than just trying to guide it from the outside. So value-based care and this move to the home and move to more primary care, getting away from high-cost hospital care, is going to be a key driver. And behind all of this is going to be technology, because without technology, we cannot achieve any of these goals that we need to achieve. And technology is going to have to drive about 3 different kinds of capabilities. One is allowing providers to practice at the top of their license, right? We don't want to have primary care providers doing tasks that a nurse could do, and we don't want a nurse doing tasks that a care manager could do. So we want all professionals to practice at the top of their license so we can get the best bang for our buck in that space. The other one is expanding venues of care. As I mentioned, home care is going to become much more important. Virtual care is going to become much more universal. There's initiatives to remove state-by-state licensing, so providers can provide virtual care across state boundaries. So all of these things are going to drive an expansion of venues of care to provide the care in the best, most cost-effective venue for each patient when they need it, how they need it, and as fast as they need it. And then finally, making data actionable. So there's a lot of data now. I think healthcare is probably the largest generator of data in our economy, but most of that data is still locked up in silos. And even when it's made interoperable and made available, it's still not actionable. So moving from siloed data to data that is integrated into the workflows to data that is actionable is going to be a key capability that technology has to deliver. Now, all of that obviously depends upon, in the short term, on what the various administrations might or might not want to do. And with the Trump administration, we have sort of a step function change potentially happening here. Fortunately or unfortunately, President Trump has not spoken much about what his healthcare policy is going to be, but we can guess at it from listening to the folks that he has put in charge, and specifically with regard to CMS and Dr. Oz, what we expect to see. So fortunately, we don't expect to see big changes in healthcare in CMS actions under his guidance. We think that Medicare Advantage is going to be basically stable without any significant changes, a slow 3-4% kind of growth in Medicare Advantage over the next 2-3 years while he's in charge. We believe that on the Accountable Care Act, there's not going to be any drastic changes. However, they will try to cut the subsidies and save money, but at the same time, they're probably going to reduce the requirements and regulations on the kinds of plans that are offered, and give more flexibility and control to the payers to offering those plans to sort of make up for the lack of or the reduction in subsidies. And then finally, Medicaid. That's the big unknown. There's been talk about cutting Medicaid expenses, moving it more to the states, but all of that is unknown, and we don't know what political pressures will eventually force the final program to look like. But there is a certain amount of uncertainty that we're just going to have to live with for the next few months. Having said that, thank you very much for your attention, and we'd love to hear from you, your comments about any of the things I said. I always learn a lot from the feedback that we get from our viewers. So again, thank you very much and have a good day.